Next point, that is urinary tract infection. So its name itself indicate it means there is infection of your urinary tract, or it is an infection of urinary system organs. Yes, it means what? There is infection to the system, urinary system organs. Mostly the lower urinary tract get affected with infection. For example, bladder or urethra. Generally, the infection, it means the lower urinary tract get affected with this infection. That is bladder or the urethra. Women at having greater risk of urinary tract infection than the men. See, I am repeating here. The woman having greater risk of this urinary tract infection than the men. And yes, I am repeating. So what is meant by urinary tract infection? It means what? There is infection to the urinary system or the different organs of urinary system. Basically, this infection in urinary tract, there is infection to the lower urinary tract, that is bladder or urethra. And generally the women are having greater risk of this urinary tract infection than the men. These serious consequences can occur if urinary tract infection to your kidneys. So what are the symptoms of this urinary tract infection? So no, not necessary that all the urinary tract will show the symptoms. All urinary tract infection will show the symptoms, but common some infection shows the symptoms. See what I am saying? It is not necessary to all the urinary tract infection will show the symptom, but the commonly show symptoms are: first, that is a strong persistent urge of urination. Then second, involuntary frequent passing of small amount of urine. Then cloudy urine. Then next, urine that appear red, bright pink, that is sign of blood in the urine. Then strong smell of urine. Then next, pelvic pain in women, especially in the center of the pelvis and around the area of pubic bone. Then burning sensation during micturition, means during their urination, burning sensation. So I am repeating the symptoms. First, that is a strong persistent urge of urination. Then involuntary frequent passing of small amount of urine. Then cloudy urine. Next, urine that appears, or it may be red, bright pink, that is sign of blood in the urine. Then strong smelling in the urine. Then pelvic pain in women, especially in the center of the pelvis and around the area of pubic bone. Then next, burning sensation during micturition. So these are the few symptoms of this urinary tract infection. Then there are different types of infection. It shows different symptoms. For example, if there is infection to the kidney, that is acute polynephritis, it shows symptoms that for example upper back and side pain, then high fever, then shaking and chill, then nausea, then vomiting. Then if infection to the bladder, that is cystitis, then it shows symptoms like pelvic pressure, low abdomen discomfort, frequent painful urination and blood in urine. Then if there is infection to the urethra, then it shows symptom like burning with urination and discharge. See, I am repeating this different type of infection. It shows different type of symptoms. For example, if there is infection to the kidney, then it shows symptoms. For example, upper back and side pain, then high fever, shaking and chill, then nausea and vomiting. Then if there is infection to the bladder, then it shows symptom like pelvic pressure, then lower abdomen, then lower abdomen discomfort, then frequent painful urination and blood in the urine. Then if there is infection to the if there is infection to the urethra, then it shows symptom like burning with urination and discharge. So these are the basic information and the symptoms of urinary tract infection. Next, that is causes. So what are the causes of this urinary tract infection? Basically, this urinary tract infection is occur when bacteria enters into the urinary tract through the urethra, and this bacteria again multiply, or there is multiplication of bacteria in the bladder. See, I am repeating here. Generally, this urinary tract infection is occur when the bacteria is enter into the urinary tract through the urethra, and it begins the multiplication of bacteria in the bladder. There are, it means the main cause, that is bacteria. These are enter into the your urinary tract through this urethra, and it get multiplied. If there is multiplication of bacteria then in the bladder. The most common urinary tract infection occurs mainly in women and affect the bladder and also urethra. First, that is cystis. It means there is infection to the bladder. So before that, that is E. coli from the gut is the cause of 80 to 85% community acquired urinary tract infection. See, E. coli is the main cause of urinary tract infection. And second, that is Staphylococcus saprophyticus. This also causes a urinary tract infection. That is E. coli, Escherichia coli, and second, that is Staphylococcus saprophyticus. These are the organism or the bacteria which causes a urinary tract infection. First, that is cystitis. It means what? There is infection to the bladder, and which is caused by the organism or the bacteria, that is Escherichia E. coli, that is Escherichia coli. A type of bacteria commonly found in GIT, and women are having more risk for developing this disease. This E. coli, this bacteria which is found commonly or basically found in your gastrointestinal tract, and basically the woman having greater risk than the male. Then urethritis, it is the infection of titis. This word indicate what? There is infection or the inflammation. Urethritis means there is inflammation, there is infection to the urethra. Can occur when GI bacteria, that is gastrointestinal bacteria, can spread from the anus to the urethra. This bacteria which is present in what? Which is found in generally GI tract. When this bacteria spread from anus to the urethra, then it causes infection to the urethra. And also second cause, that is because of female urethra is close to the vagina, and the sexually transmitted infection also cause a urethritis. Then next, that is sex. Then next cause, urinary catheters. This also increase the risk of urinary tract infection. That is the risk of bacteria. It means bacteria which are present in urine causes this urinary tract infection. So next, that is complications. So what are the complications of this urinary tract infection? If this urinary tract infection is treated at proper, then there is lowering the urinary tract infection. But it is not treated, it means it left untreated, then the urinary tract, it causes a serious complications. First, that is recurrent infection, then permanent kidney damage from the acute or the chronic polynephritis, then increased risk of birth of premature infants, then urethral narrowing in the men from recurrent urethritis and previously seen with gonococcal urethritis, and sepsis. It is a potentially life-threatening condition. These are the few complications of urinary tract infection. See here, if it is treated, then there is no any complication. If it is left or it is untreated, then it shows some complications. So these are the few complications of urinary tract infection.